listening to the Wharton Alumni Executive Education Podcast.
Welcome, everyone. Peter Bartek here, co-president of the Wharton Executive Education Club. Joining the Wharton Executive Education Group is Dr. Eneida Roldan, a highly experienced, dynamic, and accomplished physician executive, transformational leader, and educator for Florida International University. Dr. Roldan has been leading the COVID-19 testing, vaccination, and education efforts for the current administration. She joins the Wharton Executive Education Group to discuss COVID-19 hotspots across the country and the importance of vaccination and herd immunity. It gives me great pleasure to introduce Dr. Roldan.
Well, Peter, thank you so much for the kind invitation. And first and foremost, congratulations. This is a wonderful, wonderful product. I love, although I'm in healthcare is a consumer. We do deal with consumers. Although my students say they're patients, doctor, they're not consumers. Yes, they are consumer. We do have a product to sell, which is your health. But I was going to ask that, this is a wonderful thing that you have done and created. And I'm a graduate from the 2018 class, and I wonder if there has been a massive mailing to the other graduates, because, I found out simply because obviously you contacted me through, Wharton, and but I did not know that this even existed. So this is wonderful. There is a Wharton alumni club here in South Florida, which they do have get-togethers, mostly in Broward County. I think they had one not too long ago here in Miami, right before COVID. But I'm wondering if that is something that should be done, because this is wonderful. It's a way to connect, and I think that there's a lot of brain power here that we can all, really capitalize on. So congratulations again. So I hope that all the other graduates can actually receive some information on this club. I don't know if that's in your plans, but that would be wonderful. So, when Peter asked me what would be the title, imagine, anyone that is following COVID, Florida, for some reason, we always get on the news. I don't know. Whether it's because of voting, because of something we did, we're always in the news. And obviously now we're in the news because we definitely are a hot spot. Those of you from New York, as you know, you really got hit at the beginning right after 2019 when COVID-19 was actually identified. But now Florida, obviously we were a hot spot as well, just like California. We did all the lockdowns. We were doing hopefully what was the right thing. Then in came the vaccines, which we're all very happy because needless to say, when COVID hit, the most that we could do, and it was very frustrating after having gone through medical school to say, well, in order to keep you healthy, you just need to wash your hands, physical distancing, and wear a mask. And, we're so used to really telling our patients something that is effective and that you can see the evidence and you can see the outcome very, very, very quickly. But that was not the case. Let me just give you a little bit of what coronavirus is. Coronaviruses are not new. Coronaviruses have been with us for many, many years, decades, actually. They're a very difficult virus. They're what called RNA, which is hence the reason why vaccines are very difficult to define against these viruses. So your first question is, how come we got vaccines so in such a short time? Well, because the RNA vaccine technology, which is mostly what you all have been following with Pfizer and Moderna, have not been recently studied. I don't know if I've been fortunate or not fortunate, but I started as a young medical student, then an intern and resident when another, not pandemic, but epidemic was out there, and it's called AIDS, the acquired immune deficiency syndrome. And so that obviously are with the groups of the RNA viruses. And since then, science and medicine have been focused on developing a technology to bring these types of vaccines to the patients. So although you will hear that I am not going to get vaccinated because I'm not a guinea pig, quote unquote, I'm not going to get vaccinated because no one knows about these vaccines, that's erroneous. That is false. This technology has been studied now for decades. The reason is, those of you that understand the regulatory process of the FDA, the standards, the rigorous standards of how medications, pharma and so forth goes to market was followed. What was shortening is the time to market, and that's because of something called a pandemic. So this was a global impact. So these vaccines is not that we're all guinea pigs. These vaccines, the technology has been studied for decades, and it's been really since the acquired immune deficiency syndrome. I don't know how many of you knew that, but that is the case. So as we got hit with this virus, especially here in South Florida, especially at Florida International, again, the word International University was impacted because we have campuses in China and we have campuses in Italy. And if you recall, those were the two countries that was the greatest hit, especially Wuhan, and then coming down into Europe, and especially Italy. So we had to bring down hundreds of students, faculty, staff, employees, etc., down back to the United States. And obviously, the best that we were able to do was quarantine them. And we were quarantining people left and right because basically we did not know what hit us. And since that time, we have done a lot. I believe that Florida International University has been leading the pack, so to speak, to be able to be at the forefront and be able to navigate this tremendous virus and impact with all the resources that are necessary to first and foremost prevent and mitigate, because that's what medicine is about. We live in a country where healthcare is $3 trillion and counting, but yet we are not number one in all the health metrics. So you have to ask yourself why. And one of the things is because it's been very difficult for us to learn something called prevention. So what we do is we treat. And basically, as we know, when we go into the spectrum of disability and rehabilitation, the cost is higher. And that is where we are. However, with this virus, it was definitely a huge impact. It changed how people live. It changed businesses. It changed all our lives. So on April of last year, we embarked on one of the largest testing sites here in South Florida. And to date, all the way up to May, which is when we turned it over to a private company, we tested close to 500,000 people in testing the PCR. And then obviously navigating with all the preventive measures, because we have 57,000 students and about 11,000 employees. One of the things that was very impactful in the education, and those of you that have been in the executive education programs, we had to pivot to remote. This is why we are doing what we're doing. If there's one good thing, is that it has taught us to be a bit more efficient and to deliver products very differently. So the same thing happened with education. And then in December of last year, as we know, we were very fortunate, first Pfizer and then Moderna. And we started vaccinating as early as December of last year, but mostly we started increasing our numbers in February. So everything was fine. And we thought, here we are, we have the vaccines. This is great. We need to get to a certain percentage of individuals vaccinated in order to reduce the ability for the virus to mutate. That did not happen. Hence the reason why we're here. So if we would have been at about 70% of the population vaccinated, not July 4th, as President Biden said, we should have been here in May. We should have been at 70% in the month of May in order to have prevented the Delta, which obviously originated in India, and it started very strong. With every mutation of a virus, the next variant is stronger and more severe. There's something in virology called RO. RO means that for every patient that's infected, how many more patients get infected? The original COVID-19 virus, which is an alpha variant, for every patient that's infected, it would infect 2 to 3. The Delta variant, for every patient infected, it infects up to 5 to 7. So hence is the reason why you see the transmissibility being so rapid. However, severity for those that are vaccinated are less. But we are seeing now a 14% increase in just the last week here in Miami-Dade County of hospitalization with a mean age of 37 years old. Our pediatric hospitals are full. Our ICU beds are now reaching a 90% occupancy, but what we're seeing is younger individuals, not necessarily young sick, but younger individuals in the hospital. We are fortunate that in the therapeutic side of COVID, we have also made some advancement with monoclonal antibodies, with what we call the cocktail, etc. And we are able to identify through screening and testing much rapidly. And because of education and communication, people understand when they're supposed to go to the hospital. However, we are seeing a split of different groups in this country, whether you call it red to blue or whatever you may call it. But people still, with people dying and with even family members dying, they still do not want to get vaccinated. They still are in complete denial that nothing is going to happen to them. So where before we were trying to say we need to save our elderly, we are now saying we need to now save our youth. Please make note that the vaccines right now, Pfizer is only EUA approved, emergency use approval for 12 and over. So we have a whole view of very, very young kids that are getting sick. I agree, not to the severity, but yes, you have children with underlying diseases, and it is the underlying diseases that makes the vulnerability and really opens up the door for this virus. So statistics, what are we looking at? Florida is not the best in where we are in vaccination. The number one state in vaccination is Vermont. Okay, so when you look at the spectrum of percent vaccinated, Vermont is about 76% of the population with one or more, with one dose, meaning whether it's Moderna or Pfizer and or J&J being one dose, with only a 2.7% percent of positive cases. When you go all the way down, the last one is Mississippi. Mississippi right now has only 41% of the population with only one dose and at 22.1% of positive cases. Florida, we're at 59% of the total population of one dose, with currently today 19.1%. Miami-Dade County, we are at about 76% of one dose, Miami-Dade County itself, with currently 13.7% percent positive cases. We have doubled in just 7 days in percent positive. Now, something to note is that, as you know, Miami is the gateway of Latin America. So if you come to Miami International Airport from anywhere in the Caribbean, anywhere in Central or South America, you have been able to get a ticket, you get off the plane and you get vaccinated. And those statistics are added to our statistics. So when I look at statistics such as 76% of the population with one dose, basically what we're looking at is possibly that included in that are population from other countries. So I would venture to say that based on the percent positive cases that we currently have in Miami-Dade County, we are much more in aligned with the rest of US, which the rest of US is about 57, 58% of the population. So we're not even near that 70%. We are far out in months. And right now with the Delta variant, we have to, based on analytics, we have to get to about 85 to 90% in order to burn this out. So not good news. So that is where you now have seen pedaling back of the vaccinated having to wear masks. We do have breakthrough cases, and that is one of the things that the naysayers that don't believe in the vaccine are saying. Why should I get vaccinated? I'm going to get sick anyway. What they don't understand is that through vaccination, severity drops, and we're able to assist the hospitals not to use beds, but they just don't understand. So when we in business, we look at change management and changing the minds of the consumer for a certain product, this is the hardest thing to change. And some of these individuals, by the way, have had loved ones die. So how do you convince those minds? Even to the point that they don't want to wear a mask. That we're saying you have the right not to be vaccinated, but at least wear the mask. We know that is one of the protective measures. They refuse to wear a mask. So the times that I've been on TV and the times that I've been on the radio, and obviously throughout the country, mostly in the Spanish-speaking populations, because it's great hesitancy in the Spanish-speaking population, one of the questions that I ask is, next time that you go to surgery, I will make sure that your surgeon does not wear a mask and does not wash his or her hands. What is the difference? The difference is because we want a sterile field to be able to do your surgery. Now we need to build protective sterile fields around us so that the virus doesn't penetrate. So either you vaccinate or you wear your mask. But here we are. So I don't need to keep reinforcing everything that you have heard in the news, but definitely it is very real and we are paying for it. So Peter, I'm going to open it up. I think I've, kind of give you an overview of the challenges. I can tell you that one positive thing has happened. The testing has increased. People do want to know if they're positive or not. But that does not mean that large groups and large parties, and imagine South Beach, Miami, have stopped. They continue. Like I said, hospitalizations have increased 14% and cases have doubled. And every week is more and more. It's exponential. So we're not going forward. We're going backwards. So it's and as you know, in the world we have 202 million cases. The U.S. accounts for 36 million of it. So questions, comments?
So, Dr. Roldan, that was just, thank you so much for that. So, where do you see the mandates coming into play in order to get us to those levels that we need to eradicate this virus?
Peter, it is state focused. I can tell you that in Florida, there is no appetite. In fact, we are being faced with great challenges because we need to repopulate our campuses. I just told you we have 57,000 students, which in approximate, and August 23rd, I'm going to have those 57,000 students on campus. We have been mandated that there's no more remote classes. The ADA accommodations, as you know, during COVID, there was some accommodations for the vulnerable. That is gone. So if a student feels that they cannot be in class because they could be exposed because there's no mask mandate and there's no vaccination mandate, that student may have to quit that semester.
Now, there's been talk about the antibodies. How if you've had the virus, you've established some antibodies. Can you mention the strength of those antibodies and still the importance of getting a vaccine?
Absolutely. There's two ways of acquiring the antibodies. There is what's called a humoral, which is disease specific, which is when you get a specific disease, a virus, any type of infection, I can actually draw your blood for IgM and IgG. And that means IgM, whether you've been exposed, IgG means a much longer immunity. And then there's also immunity through the vaccine. With the vaccine, I have to draw a different type of test because the vaccine is a different technology. Remember, the vaccine is not a live virus. It's not like other vaccines that we basically inject into the body attenuated live viruses so that the body would then recognize it and create antibodies. So there's two different types of tests. Right now, there's some studies to say that if you have the disease or had the disease-specific antibodies are stronger than the vaccine antibody. We don't know yet. There's several studies to show that they both act the same. However, recent studies have shown that immunity will start waning off around 8 to 10 months. Remember that the vaccine just came out in December, correct? So we're into 8 or 9 months into the first vaccinated group. So for instance, I'm a guinea pig, my own. So I got vaccinated January 4th. And I drew my blood actually 2 months ago. I'm about to draw my blood again. I've never had COVID. I've been fortunate, and I've been at the front lines. I've been testing and I've been at the front lines. But protecting myself, which is hence it's supporting the fact that protecting yourself and knowing what you're doing, you can avoid it. All right. My antibody is the highest, is at over 20, and I got vaccinated in January. Now I'm going to redraw my antibody to see if it has actually waned off. Also remember that the conditions, any type of underlying conditions, can also affect your antibody level. Medications, if you have any type of autoimmune disease or any type of medication, anything like, for instance, Crohn's disease. We have seen patients with Crohn's disease where the antibody basically precipitously drops, which is now, hence, if you've all read today the New York Times, we are now considering, and probably the booster shots will come in very readily, probably within the next few weeks. So we're going to be allowed through the emergency use authorization to give a third shot to those that are highly vulnerable, either with a history of cancer, autoimmune, etc., in order to up the antibody. So remember, we only have 8 months of study, 8 of 9 or 9 months. In fact, I will be applying for an IRB to do a study on the vaccinated with previous COVID, unvaccinated with COVID, and then the vaccinated without COVID. And I'm going to be testing the different levels of the antibodies to see.
And I'll open this up. I got one more question, Dr. Roldan. So one of our GMP graduates, it's Naman Shaw, who's with Johnson & Johnson. And I don't know if you know Naman. He's involved with the vaccine for J&J, and they've mentioned that they do use a piece of live virus. And I may be stating that incorrectly. Do you have any views on the different types of vaccines and which one you recommend?
Sure. Well, one of the ones that do use that is AstraZeneca, and AstraZeneca has not been approved even through EUA here in the United States. So the type of technology or the type of vaccine has a lot to do with also the secondary effects. Okay. That is the reason why, if you recall, when AstraZeneca first came out, we had high hopes that AstraZeneca was going to be approved in the US, whereas it didn't. And if you recall, because it did give a lot of secondary effects that basically here the FDA was not too happy about. So the technique that Pfizer and Moderna use is very good. And we have seen a very good increase of the spike protein. The spike protein is the type of blood work that we draw if you've had Moderna or Pfizer, because they both have the same type of technology, which is the one specifically for the RNA that I alluded to at the beginning of my talk. As far as which one I like best, I think anyone is good as long as you get the shot in the arm, because they all produce good antibody levels. It is the secondary effect that people don't like, right? So, but we are having some challenges with our international students, again, because we're very international at the university. I have students that come from all around the world. In fact, I have one now that had the Covishield, which is really the AstraZeneca vaccine, and that particular student traveled before she was able to complete her cycle. Now we're in a bind because we are still not mixing vaccines in the US. We are under IRB protocol, but not under regular patient care. So that's also an issue because we have international students and or visitors that come in without finishing their cycle. Remember, you are fully vaccinated when you have finished your entire cycle, depending on the vaccine that you have been administered.
Well, thank you, Doctor. And please, I open it up to anybody as well. Those were my questions. Thank you so much.
Yeah, actually, Dr. Roldan, I actually have another question regarding because I've seen the news, they were talking about the booster shots, the third one, which is against the Delta and the Delta Plus variant. What's your opinion on that? Do you think we should actually get them like right away, or because I just finished my second vaccination in June? So, I mean, what if the third shot, the booster shot will be available next month or in 2 months later? Do you think that's the time that everyone should get on the third booster shots right away, or?
No, I mean, you got it in June, you're fine. Again, at least till up to 8 or 9 months, which is where we are right now with these from the cohort that was originally vaccinated. First and foremost, when we're talking about the booster and the third shot, it is not a new vaccine. It's the same vaccine. When you receive your 2 Pfizer and Moderna, let's say J&J is only 1 shot, but when you receive the Pfizer and or the Moderna, I draw from the same vial. So basically, it's not that it's a different chemistry or different science, okay? With the third shot, it would be exactly the same vial, whether it's a Moderna or whether it's a Pfizer, okay? So it is exactly the same. In fact, we use exactly the same level, volume. So it's not something different. The reason they're calling it against the Delta, although the vaccines are doing well against Delta, the efficacy drops a bit, okay? But right now we don't know if the efficacy is because the vaccine is not working at the 95th percent, it drops to about 83 or 85, or is it because you have delayed from the point that you had your second vaccine? I mean, I hate to say this, I do not want to engage in panic, but guys, we are learning as we go. We're learning as we go, right? So when it comes to the third shot, the booster, chances are the EUA, the emergency use authorization or approval, will be for the vulnerable population. I don't think it's going to be a blanket. Just like if you recall the first time that the vaccines came out, it was for the elderly, and then it started getting approved for the younger population because we wanted to protect that population. I believe that the same thing is going to happen with the third shot. It'll be individuals with history of cancer and or autoimmune or any of the diseases that we know that do not have a lot of defense against, maintaining the level of antibody necessary to fight the virus.
Okay, I see. Thank you so much.
You're welcome.
I don't know if it's appropriate. I had a business question. You haven't been a top executive at both a hospital system and a university, where we have a bunch of business executives here. What assumption would you make as an executive about what's going to happen in the next 6 months in business? What should we be thinking about, given everything you're talking about and the possible patient outcomes? How would you think about running? I mean, how do you think about running your business? But how would you advise us think about running our business? What assumptions should we make about the disease?
I think that's a great question, and we have been asking ourselves that in education, for instance, because that's our business, right? I have the healthcare aspect and education. I can tell you that pivoting to telemedicine, it really pushed us over the edge. I mean, we all know, those of you that have been following telemedicine, telehealth, it was kind of there, it was there, but it just went, and it was just exponential because it was a need, right? With education, if you ask me, and I sit on the executive advisory board of Wharton, education has to change. When you look at medical school and you look at the debt that our medical students leave medical school, which is anywhere between $300,000, $350,000, guess what? That's got to stop. So how best can we become efficient in delivering the same product? So one of the things that this pandemic has taught us across all disciplines is that we got to change the way we do things. We got to look at our own niche and look at the outcome and work backwards. When we get too used of doing things the same way, it's what Confucius says, you want to make a change, but you're doing the same thing every time. It's not going to happen. So we're seeing changes in the workforce. We're seeing changes in the efficiencies. And I think that this has pushed many industries to rethink. What about brick and mortar? I'm sorry, real estate, I'm not investing in brick and mortar for businesses. I don't think that's the way we're going to go. So I think that virus or no virus, right now, the leaders in businesses are using this to change their way they do business. Deliver their product the same way, but doing it differently. And I'm going to say something that my son, obviously I've got 3 kids, none of them went into medicine. My husband's a surgeon. I don't know. We probably did something right. I don't know. But the boy is extremely bright. He's in film. And when he was 8 years old, he says, "Mom, Dad," and he was a great student. He says, "I like science, but I'm not going to go into business because you guys work hard, not smart." And he was 8 years old. So right now we got to pivot to work smart, not hard. So that's where I see. So I think we need to use those resources that we are using because we went into a panic state, but really use it as to how we change the way we deliver our product and change business. Yes, Andrew. Andrew, you had your.
Yeah, hi. Yeah, hi.
Hi.
I can sympathize with you on many levels. I also work in higher education. We work with strategic planning and accreditation. So I understand the need for student outcomes, and it's really a continuous improvement cycle. That's a whole nother conversation about the cost of education, and more importantly, the efficacy you receive for the cost, I think is really what we got to look at. But being here in Florida, I am also very frustrated. I'm even a Republican, and I wear a mask, and I got vaccinated immediately, okay? The science is pretty clear. They didn't have enough time to grow the viruses in chicken eggs, so they made some piece of DNA, just enough to signal your body as like a wanted poster. But what I've heard, and I've had many discussions, I was recently on a cruise ship for a week where 6 out of 1,000 vaccinated people got sick with a 4% complement that were not vaccinated, okay? Everyone was a breakthrough vaccination. But those numbers, although they scared people, are really fantastic. We would be talking about it on the ship, and I'd say 4 people out of 1,000, that's like less than 0.4%. That's awesome. That's, if we had that countrywide, we'd be great. I really don't know what's going on. I mean, I know our Florida governor is giving a lot of resistance, and he's really lined up and made this a political football. I was aghast as well when I heard that children were going to school without masks. I'm so glad that my son has grown, and I don't mean to be selfish, but I really would not know what I would do if I were in your position and had all those kids coming to campus and had no way to enforce a mandate. I might suggest some kind of social media campaign. Get your local, your presidents or whatever in your community there, in your student community, to really make that a big point.
We have.
But
Yeah, we have, and by
just
the
as a
way,
side note,
even incentives, we're going to start paying to get vaccinated.
you know what? The hurricanes are coming. Let's say you have to get vaccinated to go to Home Depot. How's that? Everybody will get vaccinated. So I just wanted to point out something odd, and I'm a numbers guy. I watch numbers a lot, and I don't like the numbers I'm seeing. It's not enough. There's this critical mass to reach herd immunity, and we're not there. And so it is or it isn't, right? And we're not there, so now the risk exists. But I also noticed you mentioned that the original COVID-19 strain had a spread of 2 to 3, correct? Had a spread rate of 2 to 3?
Everyone, it was 2 to 3.
And then you said Delta was 5 to 7, is that right?
Yeah, for every person infected would infect 2 or 3 more.
But did you notice that that's following the Fibonacci sequence? What it would imply is that lambda is going to be 8 to 13.
Uh-huh. Yes.
I'm saying, am I right about that, or?
Yes. That's why we don't want to get to lambda. We don't want to get to lambda.
Yeah, that's what I wanted to confirm with you. All right. Well, thank you very much, and thank you for serving the student body and this group with your knowledge. We really appreciate you.
My pleasure. And I'm glad you are suffering with me in Florida. Thank you, Andrew. Thank you for your comments.
I just want to say it's not a political issue, okay?
No, it's not.
You really have you just have to have completed high school biology to understand it.
Correct. This is science, and believe me, we have used every single way, even our football team. And because we're a public institution, we receive state and federal monies, and that's why we need to walk a very fine line. So I'm using things like professionals don't need a mandate to do the right thing. That's my motto, trying to implore, lots of education. It's exhausting. It's exhausting. So I think I have, Peter, I think Goran.
Yes. Hi, Eneida. It's good.
Hey, how are you?
I'm very well, and now I have an echo, which I don't know. Can you hear me? No.
Yeah, we hear 3 of you.
Yeah. That is not good. I have written down my question, so you can read it, because I don't want to punish you with this.
Yeah, you're on me.
Just try turning down the volume a little bit. If you
He mentioned you wrote the question down. Can you see his question, Dr. Roldan?
Is it better now?
Yeah, if he writes it, Peter, and we can.
Peter, he's put the question in the chat, actually.
And how about now?
Yeah, he mentioned he put the question in chat. Can you see that?
Okay, let me see the question.
Yeah. Question about masks in Sweden, where the big chief expert running this whole anti-COVID effort does not believe in masks.
Is there, okay, Goran, I have here, is there any scientific studies showing the efficacy of masks? Sweden claims is very unclear, which I find amazing. Okay, so let me just, again, I always say the devil's in the detail, right? Okay, so there's confounding variables here, because when we use the word mask, my next question is, what type of mask are you wearing and how are you wearing it? Because there's been proof that when you use the correct mask and you wear it correctly, I mean, probably all of you have seen people wearing the mask this way, right? That's not the correct way. So you have to literally not have any space between the mask and your skin, which is, this is the reason why an N95 mask is the best. Obviously, the N95 is for medical personnel. Why? Because my N95 that I wear, I had to get measured. They measure you. And this is why that is the most exact mask. So when we do this, and yes, there could be studies to show, we need to compare apples to apples, right? Is it a single cloth? Is it a double cloth? You know, how are you wearing it? So until we get that exact reasoning, then I could say yes or no.
Okay, thank you. I'm sorry for my.
No problem. No problem. Let me see. Any other questions? There's one here from Daniel. In Uruguay, we have 72% of the total population vaccinated with 1 dose and 60 with 2 doses. We're currently getting a 3rd shot with Pfizer. Infected and death cases are dramatically declining. Vaccination is a solution. Amen. That's what it is. Vaccination definitely is the solution. Okay. Any
I have
other?
a question. It's
Sure.
Harushi. Thank you, Doctor, for taking time out this evening to speak with us. It's been extremely illuminating. Being in the academic field, I was just wondering, without mandated vaccinations, how much space do you think it will require to have isolation for those who are infected on campus? And does the campus have any way to accommodate that, given what the increasing spread of Delta?
Okay, so last year we did, because we were in a different situation. But this year, because resources are available to mitigate the spread. In fact, today I was presenting to all the deans of all the colleges at FIU, and the news is that we do not have isolation rooms available. So if a student needs to be isolated because it's unvaccinated, infected with the virus, or vaccinated, infected with the virus, because the vaccinated that is exposed to a COVID positive person does not need to quarantine unless they have symptoms. So let's say that whether you're vaccinated or unvaccinated and you have symptoms and you live on campus, you got to go home, or you got to be placed up in a hotel. And the reason is because we are completely, fully repopulated. Wow. So the infrastructure will not hold. So what we have in place is we have a screening method. We developed something called the P3, which is Panther Protecting Panthers. We're Panthers. And basically, we tell everyone, again, on an honor code, because we can mandate that before they get to campus, you have to answer a series of questions, of which questions goes on a traffic light. I developed that with my team. It's a traffic light. And depending on how you answer the question, if you get red, it says stay home, don't come to campus. Immediately following that, we have a COVID response team and a contact and tracing team that will pick up the phone and call. And they would ask you a whole series of questions. And based on that, they will tell you, you need to be quarantined, you need to get tested, et cetera, et cetera. Okay? Now, going back to human nature and going back to change management, can anyone ask me what the compliance of the P3 app in students on campus currently is? What is that, Andrew? 5 what? 5%? No, it's a little bit better.
5. I'm saying 5% because I know students.
It's 37%, and in our employees is 71%.
That's a huge win for you, by the way.
It is, but we need it. But with 57,000 students on campus on August 23rd, I need at least hitting 85% or more. because because if not, we're going to have clusters and outbreaks. And we will not be social distancing in classrooms. And we cannot mandate the mask in classrooms. And we cannot ask your vaccination status.
What a daunting task.
I should mention it was literally harder for me to get on a cruise ship than it was to get into surf school. I had to provide proof of vaccination and all these things to get on a cruise. Just saying.
Yeah, we cannot, the only thing we have going for us right now is potentially the health sciences students. And why do I say that? The health sciences of the Academic Health Center. Those are College of Nursing, medical school, and College of Public Health. Because they go to hospitals, if you have seen, Andrew, hospitals right now are saying you either get vaccinated or you don't come in. So there is sort of a mandate because in the governor's executive order, healthcare is carved out. Because obviously, I mean, in healthcare, you've got vulnerable population. So these students are going to have to be vaccinated or they're going to have to change career. Because by the way, in a particular hospital, 40% of the nurses are not vaccinated. So that's what we're facing. And obviously, you know, we also have to contend with the unions, which is, you know, they also have a vote. So those are the first ones. And here in Miami-Dade County, our mayor basically stated that, you know, she's mandating masks inside the county halls, you know, the county buildings. And that has not been well accepted up north, northern Florida. So, I mean, it's going to be a challenge. There's no, and putting all kidding aside, which is not kidding, science is science, health is health. And I just wish that they would take politics away from it, but that's not the case. So we will manage, we will use all our tools, and hopefully, you know, between people getting sick, I hate to say that, and those vaccinated, we hope we can reach that number to burn the virus, which is what I think, Peter, has happened in India. In India, you had a huge, you know, uptake of cases. You know, vaccination was lagging, and actually because of resources, right? But now we're seeing that with that spike, it's now coming down, just like in UK.
Yeah, I read that their spike is coming down and other countries are going up. It's almost like the fourth wave is what I'm reading. It's unknown in a way what's going to happen next, but certainly getting the vaccine is one of the great ways to help prevent what we're seeing, for sure.
Absolutely. Absolutely.
Well, I got Dr. Roland. I don't know if there's any other questions, but Dr. Roland, this was just fantastic. We really appreciate you joining us. You're amazing. You're an amazing one. I tell you, I didn't expect this. This was just phenomenal. So I do want to thank you so much for joining us and sharing. It was just fantastic. And with that, by the way, here's to Dr. Roland and your work. May it continue to just do great stuff, and we'll help you any way we can. So cheers, everybody.
Thank you. Thank you. Please help me. At least you all get vaccinated. So I know my friends will be safe.
We'll make it a requirement to join the Wharton Alumni Club. We need to see proof of vaccination.
That's a good one.
Really, if anybody on this call is, you know, I'm not a doctor, but if you're afraid about getting vaccinated, please talk to me. I've in the Navy, I had so many vaccinations in one day, literally people passed out. So I have no fear of vaccinations. I've about 1,000 of them in my body. But if anybody here has a fear, contact me personally. I don't want to, you know, do anything to expose anybody, but I'd love to talk to you about the science and why it's just really a great idea. And if you and I were going to play poker, you'd want to have these kind of odds. Anyway, with that, anybody welcome to contact me personally if you have fears about that.
I think
I should get you out there, Andrew, as a rah-rah. I should get you out there on campus.
Well, I think the statistic was
I'm
good.
only awaiting an invitation.
Dr. Roldan, thank you very much for your very useful speech. I think among us here, the statistics was good because I think we had 50 some participants, and this one is one person left in the middle of your conversation. So I assume that person not interested in what you had to say.
No,
So
thank
one
you.
out of 59, that's pretty good.
Thank you.
In the future, I would love to invite you to talk to another Wharton Alumni Club,
Okay.
the one of Houston. So I would like to keep in touch with you because your
Absolutely.
talk is very valuable. I think your email is in your website, right?
Yes, it is. I am actually also, I'm going to put it on the chat.
Okay,
Right? And it's right there. That's my email at FIU.
wonderful.
So feel free to contact me. And, you know, I say that a doctor is a healer, but a doctor is an educator as well, first and foremost. You gotta, you know, we gotta bring back that, what I call the white coat trust, which
That's
has
wonderful.
been lost for some reason. So definitely, I wear that white coat and I walk the talk.
Mhm.
Well, we're going to, just so you know, again, thank you so much. So we're going to be cut off in about 4 minutes from Teams meeting. So any last discussions? I just want to again thank everybody for participating. Again,
You're listening to
thank you,
the
Dr.
Wharton
Roldan.
Alumni Executive
Fantastic.
Education Podcast.
And again, thank you. Everybody, thank you very much.
Good night. Stay
Good night,
safe.
guys. Bye.
Yeah, thank you, everyone.
Bye-bye.
Everyone.
Thank you.